There we go. We're now recording the session. Okay, so today's session then, we are going to be looking at probably where you're going to be spending most of your time in the med round. We've done the sessions that we've covered so far are kind of all the hard work of the system. So we get all of that right. This makes this part of the system work really smoothly, really easy, and it makes your life a lot easier. So feel free to ask questions throughout, take yourself off mute and ask questions throughout, but I think you guys you should be fine because, like I say, this is the easy part. So we're going to go into med round. So before I click on my med round button, I'm just going to point out that we've got this red 34. Okay, what that's telling me is that I've got 34 medications that are overdue for the round that I'm currently in. Now, the system recognises a medication as overdue literally a minute after it's been the time it's been scheduled for. So if you schedule all of your morning medications for say 9 o'clock, when it comes to that 1 minute past 9, it's going to say they're all overdue. And we know that. We're not going to get all the meds round done in a minute. It's just the way the system works. And then it will count down. So as you start giving the meds, that number will start coming down. But it's just a point of reference to remind you that you've got medications to give. We've also got our alerts. So at the top, and you might have seen throughout the other training sessions, we had that pop-up box come up. That's oh, let's just let Lexi in. Thinking about it. Okay. The alerts will pop up predominantly if you've got either medication to give or tasks such as a stock check that's overdue as well. What that pop-up box looks like is this, and it will tell you exactly who's got medication waiting, what that medication is, when it was scheduled for, and you can access their med round straight from this point. So you would just press your go to med round button from this point, from your alerts. So that's what that pop-up box is about and why it keeps jumping up and telling you. It's basically just getting in your face to say you need to do these meds. Okay, but we're going to go in through the med round functionality button. So if I click on that, it gives me a list of our round times. So the way the round times work, there is a round open for every hour or every minute of the day. This is my training site that we're on, so I've got more round times than you will have. I think you have 4 round times, and they look like your morning round will be open till 12:59. Your lunch round will be open till 16:59. Your tea time round will be open till 20:59, and your nighttime round will be open till 23:59. So you have a round open for every minute of the day, which means you can give medication for every minute of the day. You're also not limited. So once it gets past, so if I use this morning round as an example, once it gets to 11:59 and it goes to 12 midday into the lunch round, it doesn't block you from going into that morning round. If you've still got medication to give from that morning round, you can still go into it. It's not going to block you. What will happen is if you are running late with your rounds, for whatever reason, something might have happened, and you are over 2 hours late giving a medication that was scheduled, say it was for 9 o'clock and we're now at 12 o'clock, because we're over that 2 hour period, it's going to force us to leave a comment as to why we are late, why we're running late with that round. You would just put a comment in the box and press OK. Oh. So it doesn't stop us from going in any of the rounds. Today we're going to be working on the morning round on my training site, so I'm going to just click into that. Once you click into your round, you will see all your lovely residents. If they've got something scheduled for that round, they will be in colour. So all of my residents are in colour, their pictures are in colour, therefore I know they've got scheduled medications. The other thing that shows me that they've got scheduled medications is the little red emblem with the number in it. So on Lisa, it's telling me she's got 3 scheduled medications for right now, and then so on and so forth. The other information that these little tiles are giving us is obviously the name of the resident. If you've put a preferred name in on their profile, that will sit at the top. Then you've got the room number. So as default, the tiles will sit in room number order. It doesn't mean you have to do the meds round in that order. You will choose whoever resident you want to go into first. As you start completing them, they will start going into black and white once all the scheduled medications are done, and they will start coming to the end of the list, so that the ones that are left to do will come to the front. Okay. You can also see that on, I think all of these, most of these have got those wavy flags on their profile picture. That's just highlighting to you that they've got something that needs to be approved before it can be given in the meds round. Now, if you hover over it, it will tell you what it is that needs to be approved. You might know that Lisa's Alendronic is not due in this med round, in which case you could go into the med round and carry on doing it. What I would advise is that you deal with these first, because it potentially could be a medication that's due for this round, but you're not going to be able to give it because it's not been approved. So this is not an ideal situation. If you're coming onto your med round and they've got these wavy flags, ideally you need to be dealing with them first. Okay. At this point, you're just going to choose the resident that you're going to administer first. So today, let's go with David. So I'm going to click on our lovely David. Once you click into David's profile, it takes us straight into his meds round. So I'm just going to start on the left-hand side here. So we've got David's lovely photo. So we know it's him that we're giving these medications to. We've also got his name, his date of birth and his age. We've also got other information here on the left-hand side that we might need to know whilst we are administering his medication. So we've got a diagnosis here. We've got his allergies, and we've also got all of the information that potentially we might need in terms of how he takes his medication, which homely remedies is approved for, his PRN protocols. They all sit on the left-hand side here. If you need to see that in full screen, and I'm not sure it's going to work in my training site because I think there's a bit of a bug, but we'll try it. If you need to see that in full screen, so it's all across the screen so you can read the detail better, you would use the display all button. It's not going to do it in my training site, sorry guys, but that once you press display all, it brings it all up. That's a bit of a bug in the system here. So you have all of the information that you need to be able to administer his medications. You've got his actual physical medication in front of you. Now, if you are going to be using your scanner, at this point, there will be a barcode on the label on the box of medication. When you scan that, at this point, it will recognise that it's the right medication for this person. It will recognise that it's the right medication for this round. And then what it will do is it will put a tick, a bit like that, in the label that it refers to. So if you've got a box of digoxin in your hand and you scan it and it puts a tick in it, that's the one that we're administering. Okay. Once it puts that tick in that box, then you know it's safe to go ahead and prepare that medication, because it would be at this point that it's going to give you any warning notes. So if it was, say, a paracetamol, it had already been given within the 4 hours. At this point, it would be warning you that it's already been given, which might prompt you not to prepare any right now. Okay, so that's if you're using the scanner. To do it manually, you would do your normal checks. So you've got the box in front of you, check the writing. So we've got the name of the drug at the top of the label. We've then got the strength. We've then got the time that it's been scheduled for. And then underneath the strength, you've got a little oblong shape with a number in it. That's telling you how many tablets need to be given at this time. So we need to give David 1 digoxin. We've also got underneath there the instruction. So 1 tablet to be taken in the morning if pulse is within expected range. Below that instruction, we've got any diagnosis that the tablet might be for. So this is for arrhythmia. You also, underneath all of that information, you have a history button. Now, if I press that, I haven't given any medication, but this is your administration history. So that will have a run-in account of what's happened with this drug. Because it's my training site, it clears every night. So we haven't got any administrations in there because I haven't given anything today. Your info button that's under there again, it's a training site bug, but it will take you to the patient information leaflet information. If you haven't got that pill in front of you, you can use the info button and it will take you to the information of the drug. Okay. Other points to note out, so you'll notice that we've got some blue meds, we've got some red meds, we've got some grey ones. So your blue ones are your scheduled medication. Your red ones are your PRNs, and the grey ones are greyed out because you don't have to do anything with them. They're there for informational purposes. So the prednisolone in this scenario it has been discontinued. So that, like I said yesterday when we were talking about the tabs or the session before, these yellow tabs will stay on the medication for 3 days and then it will drop off. So once that 3 days is over, you won't then see this in the med round. The salbutamol is self-administered by David. So that's why that's greyed out, because it's there for informational purposes. I know he's on that medication, but I don't need to do anything. I don't need to sign it off because he does that one himself. Okay. So at this point then, I'm going to go through and prepare my medications. So if I'm scanning, I'm going to scan the box and it's going to put a tick in. If I'm doing it manually, I'm double checking all the information and then physically ticking the box with the mouse. And you just go through, and like you would normally, you would prepare your medication. I'm just going to point out we've got a PRN follow-up in here as well. So whenever you administer a PRN medication, it will by default create a task for you to go back and check whether that has been effective or not. That's what this task looks like. Because it's a scheduled task, it's in blue, and it wants you to prepare it as if it's a medication. So we've gone through and prepared our medications. We're also going to say whether the PRN of this lorazepam that David had earlier on has been effective. So we're going to tick that. Once I've done all of that and I've prepared my medication, let's give one of these PRNs. We'll give a paracetamol. Once I've prepared all of my medication, it's all in my pot or however it's prepared, and I'm ready to go and administer this medication. If I'm walking away from this device, from the device that I'm doing my meds round on, because there is sensitive information on there, or potentially you might get a resident coming up and messing around with the laptop, you would want to lock this screen down. And to do that, you've got a pair of sunglasses, top right. If you click on that, it just locks the screen down. So you can go off and do what you need to do, administer that medication, come back, and then you can, there is no time frame on this, so you can come back in, click anywhere on that access box, and it's just going to ask you for your password. So it already knows who's logged in, and it's going to ask you for your password to get back onto that screen. And it takes you right back to where you were, so you can continue on with your rounds. So at this point, we've administered our medication. We're then going to come to the bottom right of the screen and press next. That's going to take us through to our confirmation screen. So here is what we is the information that we give the system to say what's happened with that administration. Has it been taken? Has it been refused? And any vital results that we need to put in, we put in at this point. So the digoxin, this is I'm going to just do a straightforward administration this time, and then we're going to come back and go through some refusals and other scenarios. Okay, so we're going to say David's pulse was 63, so he was fine to take that medication. His Humulin, now the way this has been set up in the system, like I touched on when we were adding on medication, when I put his blood glucose in for his Humulin, so if I put 6 in there, that was the reading, it then tells me what I need to give. So I'm giving 12 units. So I then put that amount in because I've administered that. Because there's also a body site attached to the Humulin, so I know where to inject it. And this is the first time that I'm injecting it since I've set up the medication. So I need to tell the system where I'm doing it, just to set that first site for the rotation pattern. So I would choose my site that I've injected it in. And then next time it's going to tell me, because I've done it this time at this site, the next site will be told to me. So I'll be told where to put it because there's a rotation list. Okay. Any scheduled medications that don't need a vital recording put in for it will just sit on the system. And unless you need to put an exception next to it, it will just assume when we press record all, it's been given, because that's what should have happened. So our lactulose is scheduled. If you press the little arrow next to it, it will give you all the info that you potentially might need, so the instructions. The prednisolone, again, scheduled, so it's just sitting there waiting to be recorded. And then the paracetamol, so any PRNs, you will have to put in how much you have given. So with the paracetamol, we're going to say we've given 1 tablet. I can see underneath the amount that it says minimum PRN dosage is 1 and the maximum is 2. So that's how it's been set up. I have to put a purpose in. So why have I given this paracetamol? I can free type in that box, or I can choose from the default list. So I am going to choose in pain. And then, like I say, as default, it's going to set up that follow-up task for me to go and check to see if that's been effective. Now, the default time for your system will be 2 hours. You can, like I say, at this point, choose from the drop down to amend that for this particular situation. So I'm going to leave it at 2 hours. That's fine to come back and check to see if he's been, if that paracetamol's had any effect. If it was a medication that potentially would have had a result straight away, you've got this results now button tick box next to your follow-up time. So if you was to tick that, it changes your follow-up time to a result. So you would have to put in a result of whether it was effective straight away or not, or whatever the next course of action should be. I'm going to leave that as a follow-up time. Okay. Actually, no, I'm not. So you can see in grey down. Let's do that. Okay. And then in terms of what a follow-up looks like in the confirmation screen, so below our paracetamol, we've got our follow-up task from the lorazepam that David had earlier on in the morning. So here is where I would again put that effect as to whether it's been effective, or if it's not been effective, what do I need to do? And we're going to say it's been effective. So once I've put all of that information in, I'm then going to come to the bottom right hand of the screen where it says record all, and then just press record all. Now, this is the last point. It gives you a confirmation box just to say, are you absolutely sure this is what's happened? It gives you a running balance of what the total of that tablet or that medication is after this administration. This is the last point. You, as the user on the system, can make an amendment to this administration. If you press OK here, and then you realise you've done something wrong, you've recorded the wrong number, or you've recorded something wrong, it then would be down to an administrator of the system to be able to go in and edit this administration. So you have to be absolutely sure this is what you want to record. Press OK. And then our David goes black and white or grey. So I know all of his scheduled medications have been done, and I move on to my next resident. So that's a straightforward administration, probably going to have more of those than anything else. Is everyone following? Any questions so far? No? Okay. Okay. So I'm going to go into Sammy now. I'm going to move on to my next resident. Okay, this time I'm going to say I'm going to come back to the Humulin because I've left it in the fridge, but I want to give him his other meds because he's asking for his, he needs to have his prednisolone. Okay, so I prepare them as I would. So if I'm scanning, scan the boxes and check the information, or if I'm manually doing it, checking the information and then ticking, and then I know I'm safe to prepare. So I go through and prepare all of my medication, but I'm going to not prepare the Humulin. I'm not going to tick this one. So I tick my scheduled. Okay, don't need to do anything with the grey ones, and he's not having any of his PRNs. Okay, so put my sunglasses on, go and administer the medication, come back, click anywhere on the box, put my password in, and then I'm going to go to my confirmation screen. Now, because when I press next and I've not ticked a scheduled medication, the system's saying you've missed one out. What do you want to do with it? Have you missed it out on purpose, or is it just because you're not going to give it? So it gives me the option to apply an exception at this point. Now, the scenario that I'm using here is because I am going to come back and give that Humulin. I just need to go get it out of the fridge. So what I need to do is not apply an exception. I'm going to leave it as none, and I'm going to press continue. And then what that will do is stay there until I come back, and then I'm able to give it. Okay, so I'm just going to sign off the ones that I have given. So we put pulse in for the digoxin. Everything is scheduled, so you would just press record all. Gives me my confirmation. I'm happy with that. But Sam is still in colour because he's still got that one medication that I need to come back and give. So once I've been to the fridge and I can prepare it, I would do the same thing. So I'd either scan it or tick it manually, and then I can prepare it and go through and record it. But it will just hold it there until you're ready to give it. In the same light, if you've got, oh, there we go. Any other scenario like that. So if you need to wait to give a control drug, you would do exactly the same thing. So let's just sign his Humulin off. There we go. And then he goes greyed out because we've now given all of his medication. Okay. Any questions so far about that? I must say that any queries that I get tends to be about that scenario, because people get confused about and they automatically put an exception on at that point. So if I just go in and do the same here, when this box comes up, it's kind of counterintuitive because people assume that they need to apply something at this point, and it's usually other. You don't. You leave that as none and then press continue. If you apply anything at this point, it's going to sign it off, and that's when your administrator then has to come in and edit the administration. So if you are intending to give that medication at a later time, leave that field as none. Okay. Okay, so I'm going to do a refusal now. Let's use Sammy. Okay, so we're going to go in and give Sammy her medication. I'm going to prepare it as usual. She will just do her scheduled. So I would prepare, sunglasses on if I'm leaving the device, go and administer the medication, come back. And then I'm going to go and confirm. Now, Sammy doesn't want her lactulose because she's not feeling great. She's got a bit of a poorly tummy. She didn't want to take that. Okay, so we put all the detail in for the other medications. We've done the Humulin. I'm just choosing random sites, guys. I know that's probably not appropriate. Okay, the lactulose, but we need to mark as refused. So we're going to do that. We're going to come to our exception button, which is to the right hand side of the medication name. Once I press that exception button, it gives me my list of my exception codes. So here is, and also bear in mind that this is my training site, so it's not in a great order. But here is where you're going to apply that exception code. Now, the code you're going to choose is going to be dependent on how you've prepared, if you've prepared the medication already or not. So with this scenario, I prepared the lactulose because it's a scheduled medication for Sammy. It's just that on this occasion, she has refused it. It's not one she normally refuses. So I would have to record this as resident refused and wasted because it's going to take that amount off the stock figure that I have already prepared. But it's going to get wasted. So I need to choose that resident refused and wasted because that will take it off my stock figure. If I just chose resident refused, it's not going to touch my stock figure, and then we're going to get a discrepancy because obviously we're then disposing of that medication. So I'm going to choose my resident refused and wasted. Best practice is to leave a note as to what's happened, why she's refused it. So I've got a little sticky note next to my exception code. It just opens up a free text box, so you can write in a note there as to what's happened. It's not. for me. Oops. Today. Okay, and then you just press your red tick to save that. I know it's got a note because it's now got that black tick on the note. It could be that you've prepared Sam's medication, you've gone in to give it to her, and she's really not well. She's got a she's been sick, or she's got a bit of a sickness bug that you weren't aware of until this point. You could then add an exception to all of the medication in one go rather than going into them one by one. So at the top, you've got an exception button at the top of the column of exceptions. So if you was to click on that one and choose your resident, refused and wasted, it changes them all to that exception code. Same with the note. So if you was to write a note in there, you could tick which ones it applies to and write a note to say what's happened. Okay. Let's change that back. Once you've recorded all of your information, you just go down to record all and then confirm that that's correct. And then Sammy's greyed out. Move on to the next one. Okay, any questions so far? No. Okay. I want to show you, I've got to remember who's got the control drug. Bear with me. Let's just find out. Okay. Just mess around with these dates and then I can show you. The control drug in the med round. Hopefully this has worked. No. Right, bear with me, guys. Let me find. I know one of these guys has got a control drug. It's because they're all sat in the training site to start on different days, so I never know who has it. We're going to add one in. I'm just going to do this very basic. Spine track. Okay. Just to show you what the label looks like in the meds round. There's those alerts coming up. Gonna have to approve that first before it lets me. Okay. Oh, what's going on? Sorry about this, guys. Not loving me today. Do you know what it is? It's the time. There we go. Okay, so your controlled drugs will look like this. So it highlights that they're a controlled drug by your red C at the top, and then you've got the purple banner. So the purple banner denotes that it's a witness signature. There are occasions that you can apply a witness signature to just a non-controlled drug, in which case you wouldn't have that red C, but you would have the purple banner. So a controlled drug will always have both of these. So you can see what that looks like in terms of when it's been administered. And I know that it's not set up right, but we are in the training site. So if we just go through and administer Lisa's scheduled drugs, because I've added it on and not put a stock figure onto, so that's what you would see if you've not applied a stock figure. If you've not booked in this medication, when you try to give it, it's going to say it's not got an inventory. Now my training site's set up with an e-box for this scenario, so I don't have to go back in, but you would have to physically go and put that stock onto the system. So either an interim check-in or a monthly check-in. So in terms of a controlled drug then, so once you've got a controlled drug within your administration confirmation screen, it will say right at the top straight away that you're going to require a witness. And then on the ViewTrans, we can see that it's a witness and it's a controlled drug. So that's going to be the one. Then when I go to actually administer it, so you can see what that witness looks like. It then brings up your witness confirmation box. So then whoever's giving that drug with you would come in and put their details in. Oops. And then it signs it off. Okay. So that might be a scenario if you've not got your witness with you yet, where you would be leaving that control drug and then just giving the other medications and having to continue. Any questions so far? I feel like that one was a little bit of a complex one because I had to add it on. No, so far so good. Okay, wonderful. Okay, so the last thing I need to show you on your med round is the skip all button. So I mentioned before about applying an exception to all of the medications if you've got into the room and the resident's taken ill. If you already know that they're poorly, or if they've just been taken to hospital and they've had an accident and you've not had time to go in and put them out of facility yet, you have a skip all button. So at the bottom, you've got skip all. It will just apply an exception code to all of the medications at this point. So again, you wouldn't have prepared it at this point, so you would just be choosing the most relevant ones. So what have we got? Let's say hospitalised, they've gone into hospital. Harold. Hospital by the paramedics. Okay. And then it just signs them all off and you can move on to the next resident. Okay, other buttons that you had at the bottom there, so you've got your view MAR. This will take you to a printable version of the MAR chart should you need it at that point. And then the other button you've got is add other items. So with your homely remedies, once they are set up in the system, this is where they will appear in the meds round for you to give them. So if you click the add other items, it brings up all of your list of approved homely remedies and you choose the one that you're going to administer. So you tick it, press OK. Oh, sometimes I don't love this training site. There we go. You tick it and then it puts it in, it pre-ticks it because it's assumed that you've already ticked it there that you're going to give it. And you would prepare it as normal. Okay. Essentially, that's everything in your meds round. Best practice after your meds round, you should know that you're completed because all of your residents have gone into black and white. But best practice is to come to your dashboard because this is just going to give you an overview of if there's anything left or if you're fully completed. It will automatically, so in the dashboard, there's a few reports that we're quickly going to go through that give you quite important information. But the default one that it sits on is your med round progress. Okay, so this is what you're going to refer to after your med round. The way it's set up, so we've got all of our hours of the day on the left hand side. The total items column is how many medications are scheduled for that hour of the day. And then your items remaining is what's yet to be given. So everything, all the time frame in white is time past or time up to the present. Everything in grey is time to come. So you would expect everything in this items remaining to be at 0, bar maybe a few exceptions. If you have got those exceptions, you'll see the number is blue because it's a hyperlink. So if you can click on it and it will tell you what your outstanding medication is and who it's for. Now you can't get to the med round from this screen, but it's just a bit of a prompt, maybe a handover to say Susan's not had an overrapid for whatever reason. You need to go and do that as a priority. Okay, and then your percentage complete column again is just a bit of a quick check-in. So if they're all 100% complete, you know you've finished your meds round up to that point. So that's your meds round progress. That's also printable. So most of these are printable. There's a printer icon top right. Providing you've set the laptop up to be linked to a printer, you can print that for handover if you didn't want to take the laptop in. Other useful reports on the left-hand side here. So we've got exceptions. Well, no, we'll go missed meds because that's the most important. So your missed meds, okay? If I click on that, missed meds here, it's telling me that I've got 138 in my training site. That's just because nothing's been given. I'd be very worried if this was your live site and you had 138 missed meds, but hopefully that won't be the way. Essentially, your missed meds are your alerts come midnight. So if your alerts haven't been dealt with by midnight, so midnight, so 23:59 is the last point you can do anything with them. Then when it clicks into midnight, it then becomes a missed medication. You can still action the missed medications from the missed med screen. It depends what permissions you have, whether you see this or not. But let's use Lisa as an example. So her digoxin at the top there. If I come all the way to the right hand side, there is a tick box. If I tick that and come down to the bottom right hand side, there's an insert button. If I click on that insert button, stuff. Can you still see me? I just had a bit of a Teams was telling me that it's dialing me into somewhere.
No, can't see you. I can hear you, but can't see you.
You can see my screen. That's good. You can hear me. I thought it completely logged me out of the call then. Okay, perfect. You can still see the screen, can't you? Oh, yeah, at what point did I drop out? I'll start again with this one. Okay, right. Okay. So you would obviously do your investigation. So if you've got a missed medication, you would have to have those conversations and look into why it's not been signed off as per your normal policy. But this is how you're going to action it on the system. So you would, let me go back just in case you missed it. You would tick the relevant medication. Now, if you didn't have this many in your missed meds and it was just one resident and all of their medications for a particular round and you needed to apply the same code to all of them, you could use the overriding tick box at the top. I'm just going to apply it to the one, the digoxin. So you tick the medication, come down to insert bottom right, and it brings up this box. Okay, we've done our investigation. I know why it's been missed off. So what I'm going to do is say when it was given. Now it will default to the round that it should have been given at. If for whatever reason it was given later, or you probably wouldn't want to change the date because you probably would omit it by this point, depending on what the medication was, whatever advice you'd taken, you would reflect the information here. But I would assume you wouldn't be changing the date here. You would be giving that day's medication. So we're going to leave it at the date for when it should have been given, but actually it was just given a bit later. So we put that as 10 o'clock. I'm going to say who did it. So choose whoever was on duty and dealt with that administration. And actually what's happened is they went in originally to see if they could give the medication. Resident was not complying, wasn't going to take their meds. So they went back later on to try, but actually when they went back later on to try, they forgot to come and record it on the system. So the outcome was that the resident did take it. So I'm going to choose no exception because they had the medication. And then you just write a brief description as to what happened in the notes. Okay, whatever that description might be. Bit of a tip, it's going to ask you for this again in a minute, so I would copy that. Once you press save, it's asking why you're making a change. You can use that same reason. And then it's asking you what you want to do with the inventory. Now, it depends on what's happened with the drug. It hasn't been recorded as of yet because that's what we're doing now, but it was given at the time, so we do need to decrease that from the inventory. So I'm going to choose decrease by. Okay, and then it signs it off for us. That digoxin is now not in the list and it becomes, it's not a mismed anymore. So that's how you action your mismedication. Okay. The other thing I want to show you before I move on to any of these other reports is if you did have a scenario where someone's been doing a med round and they have accidentally recorded something as an exception, but they didn't mean to, they were meant to give it. So you need to administer that, edit that administration. You can do it in two ways. So we'd come to med round, the first way, go into the round that they were in, and go to whoever it was. So let's use David as an example and say that this digoxin, we're editing this administration because we later found that he'd spat it out and we need to record that as so. You would come to your history. Once you click on your history, you can see the administration that Elizabeth did earlier on, the one that she's saying is wrong that we need to edit. We're going to highlight it. We're going to view and edit. And then again, similarly to what we just did when we were adding in an insert for the mismedication, we're just going to edit this administration. So top right, edit. And again, this functionality, not everybody will have, it will just be administrators on the system. So this is what the administrator would have to do. They can say when it happened, who was dealing with it, and whether it was an exception or not. So actually, we've said that David took it, but actually spat it out later on. So let's go resident refused and wasted. And then you would just put a description of what's happened. Press save. Again, I should have copied that because it's going to ask for the reason why you're changing it. And then it's going to ask you again what you want to do with the inventory. So it's already, this time, it had already recorded the administration. Now, depending on what you did next, so are we saying that we went back and gave him another one and disposed of that one? Or are we saying that he's just admitted that? Depending on what you've done, you decrease or increase the inventory. But at the moment, what it's saying is it's taken one off because it thinks David's had it. And what we're going to say is that we went back and gave him another one. So it's still been recorded that he's had it, but we need to decrease it by a further one because one's been disposed of. Okay, we can then see now that we've got a blue pencil that denotes that it's been edited. And we can see now that we've got an exception recorded. Okay. The other way to do that is to come into residents and orders. This might be a slightly quicker way. Come to your resident in the list, come to the relevant medication, and then you've got that same admin history button down at the bottom left. Takes you into exactly the same box. So you just follow the same process. That's just another way to get in to do that for those administrators. Okay. The last few things I want to show you in the dashboard then is your PRNs given and your exceptions. So PRNs given, for both of these really, they are just good to see patterns. So as default, it will sit on today, but you can go back to yesterday, last 3 days and last 7 days. And then in your reports, you can go back even further, but it's just good to kind of see patterns. So if someone's relying on certain PRNs, if it's the same people, if it's the same PRNs, it's just good to pick up those patterns. The same with exceptions. It's good to pick up on who's refusing. Is it the same drugs? Is it the same people? Is it a certain person that's giving it? It's good to pick up those patterns, and you can toggle that one back as well to the last 7 days from here. But again, you can go further back in your reports. Essentially, that's everything I need to go through today in terms of your med round and what you can, the information that you can get from your dashboard. Does anybody have any questions about what I've covered today? No? If you, when you start using the system, if you have a bit of a blank moment, you've completely forgotten how to do something in the system, you have this support functionality down at the bottom of the screen. So once you're logged onto the system, where it says Access Medication Management, this is a link to the online guides that we have. So if you click on that, and this will work if you're within a Wi-Fi, if you've got Wi-Fi, it takes you to this web page, and you can search for potentially whatever you're trying to do. So if it was something to do with homely remedies, if you typed homely in the search box, it will bring up all the knowledge-based documents for whatever you're trying to do with homely remedies. You can be more specific in the search box, but if you bring up homely remedies, you might find a knowledge base of something that you've not seen yet. And then you would just go into the guide, and it will bring it up and give you step-by-step steps basically as to how to do whatever you're trying to do within the system. Okay, so if you've completely forgotten everything I said today or in the past few sessions, you've got this as a bit of a backup. Last thing that I want to show you then, so it's just a bit of a tip. You have your log off button. Okay, the log off button will prompt. So if you try to log off whilst the system is syncing, potentially you've been doing your meds round in an area of the home that hasn't got very good Wi-Fi, but you've just brought the laptop up to an area of the home that has, so it's started to sync that data. If you try to log off before that's finished, it will warn you that it's still doing that, and then it will prompt you to give it a little bit more time to finish doing that. You can log off. It just means next time you log back in, it will continue to do that. The only danger with that is then if you go, say, into the Office desktop and try to look at that administration, it might not have synced up just yet. So I would always use your log off button to come off the system, because it'll prompt you and it will allow you to give the system time to sync up. Now, if you use the cross at the top, it will just it will shut the page down. It won't give you that prompt. It won't say we're still doing something. It will just completely shut down the system for you. Like I say, when you go to log back in next time, it will continue doing what it was doing, but it's best practice to let it finish whatever it needs to do before you log off the system, so that it syncs up with any of the devices that you've got in the home. Is that okay? That's it then, guys. Haven't got anything else to go through with you today in terms of content. We